I'm Heather Solis. This is my presentation on the role of nurses in reducing the Black maternal mortality rate. Black birthing people in the United States die at a disproportionate rate relative to their population size and in comparison with other race and ethnicities. Per the Nurses' Code of Ethics, the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. Nurses have a duty to take every possible step to change the disparity in health outcomes for their Black patients. Nurses are on the front line of healthcare, spending the most face-to-face time with patients. Nurses are advocates for their patients. Being educated about racism in medicine, being trained in how to recognize racial bias in themselves and in others, will enable nurses to give their patients the highest quality of care and should help change the disparate maternal mortality rates. The average maternal mortality rate in the United States is 28.3 deaths per 100,000 births. This is depressing enough. Compared to the country with the next highest maternal mortality rate, we more than triple what they have. In the US, non-Hispanic Black birthing people die at a rate of 55.3 per 100,000 births. White birthing people die at a rate of 19.1. Hispanic birthing people die at a rate of 18.2. The history of racism in medicine is historical and multi-layered, but I'll give a brief example of how studies conducted by proponents of slavery are still influencing medicine today. In a 2016 study, medical students were asked about medical racial myths and if they believed them. Some of the myths were that Black people's skin was thicker, that their nerves were less sensitive to pain, and that they were more fertile than white people. Over 50% of the students believed at least one of these myths. Then the study found that the students who held false racial beliefs were actually acting on them. They were not able to accurately identify the pain levels of their Black patients, but they did accurately identify the pain levels of their white patients. And they prescribed an inadequate dose of pain medication to their Black patients. So not only did the students not understand their Black patients, they didn't believe them. Serena Williams, the famous athlete, was not listened to or believed after she gave birth to her daughter, and it nearly cost her her life. She had developed blood clots after her cesarean section, and even though she had a history of blood clots and was having symptoms of blood clots, the nurse told her that she was talking crazy. She had to relentlessly advocate for herself because her nurse did not listen to her or believe her. 4 surgeries and a week later, she was finally discharged. They had found an abdominal hematoma and multiple blood clots. Nurses need to be educated about false racial beliefs, be aware of unconscious bias, and be able to recognize problematic attitudes that influence decision-making. Nurses will be able to then save more lives and uphold their duty to protect human rights and reduce health disparities. Thank you.